Welcome back. If you've seen a lot of deer lately, you're not alone, and that means hunters aren't far behind. Deer season, surprisingly, can be a very busy time for surgeons at the UofL Brain and Spine Institute. Dr. Thomas Altstadt joins us today. And Doctor, thanks for being here, first of all. We appreciate it.
Thanks for having me.
You see a lot of this, the ER being busy from hunters getting hurt. What's happening?
Well, fall is here.
Yeah.
And that means deer season is here.
Right.
So at this time of year, we see a lot of deer hunters who have fallen out of tree stands, unfortunately. Okay. And this time of year, we see a lot of preventable spine fractures that need treatment at UofL Hospital.
I was just telling you, a friend of mine in his 30s had to have a hip replacement. What kind of spine injuries are you guys seeing?
So I've already seen 2 significant spine fractures this year from hunters who've fallen out of deer stands. So typically it depends. If you fall and land on your heels, we typically will see spine fractures in the thoracolumbar region, but we can see even cervical fractures.
Wow, so this can be really dangerous. What sort of preventative measures and safety equipment do hunters really need to look into and think about before they get in these tree stands?
So I'm a big sportsman myself.
Okay.
I do a lot of hunting. And
Great.
So over this past few weeks, I've thought about this a lot. So I recommend that everyone get out and check their stands. So this weekend is muzzleloader season, so there'll be a lot of folks out. So get out, check your stands, make sure the straps are secured, make sure the ladders are tight. Take a look, and then don't forget to wear your harness. So wearing a harness, which I brought here, is extremely important. Should you fall out of your stand, it will prevent you from having a significant injury.
Okay, that's a lot of good information. What kind of treatment options does UofL Health Brain and Spine offer to folks? Well,
so if you do have a traumatic injury to your spine, you would typically be brought to University Hospital as an emergency situation. Unfortunately, a lot of times those fractures do require surgery. They tend to be pretty severe.
And of course, you can help anyone in any situation like that there. But yourself as a sportsman, you probably know a lot of times hunters, especially if they're by themselves, they can get themselves into a real predicament if they don't have all this safety equipment.
They certainly can.
They can be alone.
They can be alone. So I always recommend the patients carry their cell phone. At least let somebody know where they're going to be, when they're going to be there. So if they don't come home, we know where to look.
Wow. All this is really good information, especially to people I know. Thank you so much, Doctor. We appreciate you being here.
Thanks for having me.
All right. Well, still